and put that 10:45 in.
Oh, what about it?
If you don't have anything for me, I'm gonna wait for you to go to 10:45 deal.
We don't have anything yet. Thank you.
Thanks, Cody.
Becky with us?
Come on up. Hi,
How are you?
doing well, how are you?
Doing great.
Good, I believe I shared these packets with you. Great. My name is Becky Gray, I'm the Director of Building Health, Inc. We're a nonprofit subsidiary of the Community Health Center of Southeast Kansas. They started this nonprofit to address social determinants of health, so that's everything in our environment where we live, work, and play. And today I'm talking about our Caravan program, which is a public transportation program. This time of year is when we apply for grant funding through KDOT to help support the program. So we're here to ask for a letter of support, saying that to support our application to the Kansas Department of Transportation, and to also just give you some program statistics about what we've been doing in Cherokee County. So the packet includes transit-dependent demographics. That's the phrase that is used by the Kansas Rural Transit Assistance Program. And it really outlines who we might assume have more difficulty transporting themselves. So we look at poverty, we look at age, we look at households with single vehicles, households with no vehicles. Probably data that you all are familiar with. The way our program works is pretty easy. We have a dispatcher, so we ask that the public call our dispatch line, which is 833-228-7433, and call well in advance. We are typically scheduled out about 2 weeks in advance, so we just ask people to kind of plan ahead. If we can squeeze someone in, we will. If we can't, we typically refer to other transit providers like our friends at CCAP, who are also here to talk to you about transportation today. And then I think what's unique about our program, though, is that we can also bill Medicaid for people who are transporting for medical purposes if it's not an emergency. I know in Cherokee County, your ambulance service also does non-emergency medical transport, which is fantastic. If we have a request from a rider who needs a higher level of service, we do refer to Cherokee County because you do have that ambulance that's a little higher level of service than we can support sometimes. We use the billing from that medical transport to make up the local match that's required of us from the KDOT program. So they require either 20 or 30%, depending on the program that we're operating, to be local match. And so our goal is to increase our non-emergency medical transport billing enough that we take care of all of our local match through the Caravan program. Currently, the Community Health Center of Southeast Kansas guarantees our local match, and so whatever Cassie she just got married. I'm just saying Cassie Sawyer, our transportation manager, whatever. Whatever Cassie can't make up through our medical billing, CHC is filling in the gap for us for now.
Did you mention Medicare as well, or just Medicaid?
It's primarily Medicaid.
Are you able to bill for Medicare?
There are some Advantage plans that are partnering with some of the broker companies, so moving forward, that is a possibility, but it's not something that we currently do.
Thank you.
So in Cherokee County, we have provided over 1,700 rides in our last program year. You can see on like the third page, I believe, a breakdown of how much of that was KDOT and how much was our non-emergency medical transportation. And then new to us this year, we realized around the beginning of the calendar year that we were turning back a lot of calls that we couldn't provide rides for. So we started tracking that just to see what the volume of need is. And so that data is also in the program statistics page. It turned out to be about 15 rides per month that we weren't able to fill in Cherokee County. Again, we do refer to our partnering organizations like CCAP, make sure people know where they need to go. Our trip purpose is also documented in this presentation, primarily medical trips. And again, if you look at the data, you can see there are 900 medical trips compared to 700 general public transit rides. But I will say a lot of those general public transit rides are to medical appointments as well. So typically, we can look at our ridership and say, we're predominantly older and disabled in our riders, so a lot of people do need assistance getting to and from the vans and in and out of the vans. We do deliver some people to work too, however, and then the category of other is typically for goods and services, so that's taking people to the store or the pharmacy or wherever they need, laundromats. And then the last page you see are our pickup locations, so you can kind of see where in Cherokee County the demand for this service is greatest. I'm really pleased to see though that we are reaching the rural out in like West Mineral and Scammon and able to provide rides to people who are in those locations, off the side of the roads or bicycles. And then the very last page is just a picture of all of our drivers and our dispatch team and billing team and management team with one of our caravans. We have highly trained drivers. KDOT does require some of it, and then through the Community Health Center of Southeast Kansas, we bring in some additional training around basic life-saving skills, things like that. So I would be happy to answer any questions you might have.
You've outlined it all in your presentation in that pamphlet I got at my room, and here today, appreciate the service. Do you have a form letter?
I did send us out a sample letter to
A sample?
county clerk.
Okay.
I'd be happy to follow up with it again.
Well,
to go see if she has it.
Well, we'll do it
Okay.
after the meeting,
Okay.
yeah. We will definitely take care of that. We
Great,
appreciate the service and
thank you.
can certainly do that very small thing. Anybody have any questions? Are there any destinations that you refuse to take people?
With the general public transportation, it's not up to us to decide a destination, so, no. With our medical transport, it's always to a medical appointment, but we haven't had any crazy requests, I don't think.
You haven't taken anybody to the casino?
Not that I'm aware of, I do think there is, Cherokee County, have we gone to the casino?
We've taken a few.
Okay.
We take some people to bingo, really just wherever they'd like to go. So there are no
Yep.
limitations as long as it's within legal reasons. They can go anywhere they want.
Do you cross the line,
We cross county lines,
but not state
but
line?
not state lines with the KDOT program. With the non-emergency medical transport, we do take a lot of people into Missouri, down into Oklahoma.
Quite a demand.
Quite a demand for that, yeah. But with the KDOT, we're not allowed to cross state lines
Right. Okay.
unless we add more layers of complication.
You have any questions?
Well, thank you for your time.
Thank
Thank
you.
you.
I appreciate you, Commissioner.
Appreciate the service, and we will get that taken care of.
Thank you very much.
Do you have a card just in case we,
I do not have a card, but I would be
we'll
happy.
find you, just in case we don't have any information on that,
Okay.
but we sure will.
We should. Very good.
Thank you. Appreciate it. So, let's see. John Terry. How you doing?
Good, how are you?
Doing well.
Good
We
morning.
spoke on the telephone,
We did.
Zoom call.
Papers here. Good morning, Commissioners.
Good morning.
Good morning.
Thanks for hearing me today. My name is John Terry, and I am the Community Relations Manager for IdeaTech. We are a fiber optic internet company based in Buhler, Kansas. I actually work from a home office in Galesburg, Kansas, right up the road in Neosho County. We recently invested $9 million in Baxter Springs to privately fund a fiber optic internet project there. And we have applied for a Kansas Broadband Acceleration Grant to build fiber optic internet to some of the rural areas that do not have service outside of Galena. I don't know if the map was included with the agenda, but we are looking at building over 1,300 premises. Riverton is included, areas of in and around Lowell are included, and basically all the way down to the Oklahoma-Missouri border. If you guys don't have a copy of this map, I can pass it around for viewing. Yes. One component of this particular grant with the state, though, is a co-investment match. I also brought this with me. The way that the state writes the co-investment requirement. The Kansas Office of Broadband Development recognizes the value of partnerships between service providers and co-investment sponsors that identify gaps in broadband infrastructure and establish community priorities. Because of this, applicants are required to include co-investment funds as part of their application. Eligible sources of co-investment funds can be from the local, county, and eligible state programs or other contributors, county commission grants, ARPA funds, etc. For this program, co-investment funds can offset the match amount. The minimum co-investment is $1. So, the state basically is telling us, or is requiring, that we get at least a $1 co-investment from a county entity. So I'm here to ask the commissioners if for this particular project, you would be willing to co-invest $1,000 toward this grant application to ensure that this area gets built.
John, what you just read, that clause, it was all government, but when we were talking on the Zoom call, I'd asked about private. You thought that that might be a,
That is something that I can solicit if the county cannot co-invest.
so it can, okay, it is allowed, it's that
It
match.
is allowed.
Yeah.
Yep, I mean, that match can be $1
Yeah.
from a private resident. However, in the past, on successful KBAC grant applications, county co-investment has always been a component in my experience.
I was suggesting maybe reach out to downstream of that area B. D1, we talked about resources. Are there any other businesses that?
D1
I
has
talked
fiber.
to a couple of,
D1 has fiber, they use optic.
they do what, Michelle?
They have fiber, they use optic communications.
Okay. I talked to 2 people in the Riverton area and 1 on Baghdad Road where this would reach. And they, obviously it's not fiber optic, but they're very happy with their internet, with the speeds of it. You have a lot of home workers that, and 2 of these I talked to were business at home people. So, in that we haven't appropriated anything, I mean, if we need $1 to make it look, but I'm opposed to $1,000 personally. We didn't appropriate anything for it tonight.
Well, no offense, but you're like the 9th fiber company that's come in here wanting support from the county, and this, that, and the other for these tax-funded projects. I mean, when you get down to it, yeah, it's a grant, but it's still tax dollars to shoot your fiber next to the last guy that was in here, and next thing you know, you got 4 fiber lines running up the same ditch.
Well, to be clear, this grant project does not work if there is already fiber or any service available that is considered broadband speed. So that would nullify.
Well, I live in your area, and I can tell you that we've got pretty good internet down there.
What is considered broadband speed?
100 megabits per second over 20 megabits per second is the definition of broadband. And based on the BDC data that we use to look for these grant fundings, that does not exist in that footprint that's outlined on that map. So the total cost for this project is $1.8 million. It would be a 50-50 match between the state of Kansas and Ideatech. And at 1,300 passings, the way we looked at it was $1,000 would be less than $1 per passing for this. And I believe the total fiber build out is 79 miles of fiber.
One thing to keep in mind, that being a rural area, it is much, much more expensive, obviously, because of the households you can tap into. But to Corey's point, we've had there's a lot that are seeking that very same thing, and I don't know what our role should be, but I would definitely be in favor of a letter of support. But as far as appropriating any funds, we don't have any appropriated.
Right.
Your thoughts, Scott?
Yeah, I got letter of support too. Yeah, we don't have any funds, we don't have anything for the funds right now.
Well, I think you have your answer, John. We'd be glad to sign a letter of support.
Okay, I will send a template support letter over to Taylor, and I appreciate that. And I will talk to the townships and talk to some of the others in this area.
That
to
is
find out.
something else that we talked about being a possibility,
Right,
townships.
yep. and I think that's Lowell and Garden Township, if I'm not mistaken.
Both of those have
Yes,
nice reserves.
okay.
Yeah.
I will get contact information for the townships and go discuss this with them.
You can get that right over there at the clerk's office.
Okay, great. Thank you, guys.
Except for Lowell. They
Oh, they don't have anyone.
They don't have anybody right now,
Yeah,
but
they
we're
might.
working on that. We'll get that. You have an end of October deadline, don't you?
I do. The end of this, or the majority of this grant build is actually in Garden Township though, so I will discuss it.
That's true.
with Garden.
Yeah, it wouldn't touch Lowell, would it?
There's a very little piece in Lowell, and when I looked at the district map, most of this is actually in District 1, some in District 2, very little piece in District 2, and then some in District 3.
Okay. Well, we thank you for the
Thank you guys for
presentation.
hearing
We'll
me
get the
out.
letter.
Appreciate you.
You'll have that template to us today?
Yes, I think she already has it, but I'll double check
Okay.
and make
Thank
sure I
you.
get it to you today.
Thank you, John.
Thank you, John.
Thank you.
If anything else for me, Kurt should be down in just a few minutes.
What?
Need anything else from me, Kurt will be down in just a few minutes.
We do, we're about to have a, do you need the buzz out of here?
I do, yeah.
Well, that messed up that.
Which one's that?
We were gonna have an executive session with you right now.
Oh,
How many minutes do you have?
0. We spoke
Okay.
on Friday, I told you I had to leave at 9:30.
Okay, well, we'll see ya.
Okay, Kurt and I did talk, that was where we left it Monday, is you don't have an executive session about that. Kurt and I had spoke about transitioning things.
So are you gonna be back for the 10:15 executive session?
No.
Okay,
No.
all right.
Okay.
So, Matt's probably not,
We've got Casey Brown with CCAP.
what about CCAP?
Are they next?
Yeah,
Okay.
you're right. Trying to bounce around you, Casey, come on up. Cause we don't have good news for you either. I guess it's a psychological thing.
Well, we sent some stuff down, did you guys get copies?
Yes, yes.
Okay. So, we wanted to say thank you for the letter of support, we have that for the upcoming grant year. But we operate a little differently than our friends at CHC. We rely on the local communities to provide our match. To date, not a single township, city, or county has put a cent into our transportation. It has all been the state, the LHEAP, and CCAP who
And yeah,
very
hang
big in
on
that burden.
just a second, we have a,
I know the city of Columbus has pledged.
Pledged for next year, yes.
Okay,
Hadn't
so
got
they've
there.
pledged you 5,000.
Yes.
how much?
5,000.
Wow.
So up to now, there have been no pledges. Their pledge for the city of Columbus is for the 26-27 year. And we're looking at the potential need to suspend services at the end of December, because we cannot utilize or draw down our local match, or our state and federal components without the local match being in place. And we only have local match funding that gets us to the end of December. So we're looking at a suspension date that starts January 1st.
Now, is this for Cherokee County or everywhere?
Cherokee County,
Just Cherokee County?
yes.
Okay.
And then, right now, the only thing we have that supports the next year's application is the $5,000 from the city of Columbus. So, we are here today to discuss what you guys would like to see, what you would want to see for transportation services down here, and what you're willing to support for those services as well.
Well, you're telling us that you can't get past December, right, with what you have?
Correct.
So you're covered for this year?
Not from July 1. This runs from July 1 to June 30. So we have funding from the state, from the Fed, and from the LHEAP, and then from KDHE that gets us to December 31st. After that, we don't have funding to finish the grant.
So
year.
it's 2026 that,
2026. So we've got
Right.
twofold problem. 25, 26, we don't have any funding in 26, and then we could theoretically restart services July 1 under the new grant cycle. But right now, the only funding we've got is $5,000 for the city of Columbus, which is not enough to buy one full 8-hour day of service from local match for the year.
not enough to provide one full day?
No. $24,000 is a 3-day service for 3 8-hour days for the full year. A 5-day service, which you have had which we've been providing for the last year and a half, is $40,000 a year.
Wow.
The rest of it, and that is only 30% of the cost. The rest of it is all taken care of with the application with CCAP.
So bottom line for the money that you would need, that again, we haven't appropriated, is how much?
To finish the year out at the current 5-day, it would be $20,000. But that's why I said what you want to see. We work with the local communities to design those transportation systems. So do you want a 3-day a week? Do you want a 5-day a week? Do you want to start at 3, suspend for a couple of months, and then start back at 3 with the city in July? It's more of a conversation than it is anything else of what you guys see you need, because both our ridership's pretty steady at 5-day a week mark.
Can I ask you, when did you start in Cherokee County, a caravan?
When did it start?
A caravan.
Oh,
We have been operating in Cherokee County, I believe, for 2.5 years.
2.5 years? Okay, thank you. I'll be frank for myself, I think this is a very worthy project, but last year when you were here, you listened to us, we didn't appropriate funds. So last year it did come to my mind, but in your presentation, when you talked about taking people to downstream, I really lost a lot of interest. I just don't think that that's a necessity.
General public transportation is designed to take them where they need to go, where they want to go.
Yeah, I get that.
But we don't do a lot with the casino.
we
have
don't
few,
do a lot,
but
and
it's
some people
not-
go there to work.
Now,
You say there's not a lot to
And
do
to
with the
eat,
casino.
sure.
If you look at the last page of the presentation, they're not even in our top 10.
I called, Friday to see if I could get a ride there, and I thought, am I remembering this well? And was told that I could, but, I don't know, guys, we haven't appropriated funds.
1,500 rides a year.
Yeah, close to 60.
That's who you're letting down if you don't help them out.
What'd you say, Tony?
1,500 riders a year, you're letting down.
It's not that we're letting them down, the problem is we have a budget process in Cherokee County.
Right.
Everybody knows the timeline of that.
And they,
And then we do that, and
They
then
asked for it
everybody
last
comes in
year.
after that and wants a whole bunch of money, and we've never appropriated it.
but
That's
why,
the bottom
why
line.
didn't you appropriate it after you got the presentation last year? You've had a year to think about it and realize how important and necessary this is. I'm not here to judge who goes where, I'm here to get people to all kinds of places, and
We have
it's just
had
something I've
time.
wanted for this county for so
We have
many
had a
years.
year to think about it, but it really doesn't come to our mind when we have, what do we have, 20, 30 budgets that come in here, and you know what the timeline is, and
At least.
we're toned into those, and we do budget
So
work
you-
sessions.
There's no money? Are you saying there just isn't any money that you can help with?
I really don't know where, I mean,
The county
the only
budget is
discretionary
extremely
money
tight.
is courthouse, and that is very precarious to
Very,
take that
very
kind of
tight.
money out. There's so many variables in that courthouse fund that we have no control and can't predict, and first one comes to mind, my mind is autopsies, it's costing us over $3,000. One, we had 16 before the end of June this year, just things you don't plan on that come up like that.
We're open to conversations about other alternative funding sources. If you have other leads, we can pursue. But right now, the cities we are waiting, so everyone is waiting for everybody else to take the lead. All the cities in the county have all said, well, we want to see somebody step across the line. Columbus did,
Starting.
but we haven't had anybody else join us. And it's not our service. It is your service, it is your community service. We are
Right.
just facilitators.
People can keep in their jobs, so you keep people in this county. People can, if I can't drive, I'm moving out. Because I don't wanna, I can't depend on someone to get me around. And you want people to stay here, pay their tax. It's a really good financial choice, and it's a compassionate choice too.
When you call, how long do people, like, do you have a waiting list of?
You can, reserve up to 7 days in advance.
I was just curious.
But we do fill in the void often on the same day when our friends from CHC call and they've got a medical, we can typically get them in.
Do the people that ride, do they pay anything?
So we ask a $1 donation, but that is, actually goes to the state's portion rather than anything else. So anything that is donated, actually the state is allowed to take it off of their reimbursement rate. And if you would like time to sit down and talk, we can come down and meet you in a work session and give you a little bit to review and think too.
We get taxes from the other casino. Quite
Part
a
of our
chunk.
budget, what helps keep the mill levy low. It's
Well,
already accounted for.
but it's not like they're,
Michelle, will you put this on the agenda for next week, and not that you need to be here, but for us to have time to check and see what's in courthouse? It's the only one I can think of that has any,
That'd be the only one. I hear that.
yeah.
And feel free to call us, and if you've got questions or ideas or wanna look at a change or wanna know how much
Do you have a
2
card
days
with you?
cost, 3 days cost. I don't have any of mine, but I've got one.
is it
couple
on
of
this
doors.
information?
Scott's is on the information. But there's James.
I will call you after our meeting next week, see
Okay.
if Michelle's sitting on any money somewhere in
Yeah.
her office.
Yep. All right, well, we appreciate it.
I get what you're, I mean, it is a service, and it's a valuable service. We have a lot of people, I live in a town that doesn't have a grocery store, and there's a lot of these older people that are living on Dollar General food.
Well, and that's where a lot of our trips
Yeah.
outside of the medical go. It's food. It's food related.
Most of our passengers are going somewhere within the county to spend money. For groceries, for medical,
Yeah.
for laundry, anything like that.
Necessity, yeah.
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 Well, thank you.
Thank you, guys.
Thank you.
And if you're still going next year, try to keep in mind, our budget process starts about June, July.
We'll be here.
We did
Okay,
Yep.
twice.
thank you, guys.
That's when you.
So you're right, we didn't do that. Thank you, Phil. Thank you.
Well, we might as well call Matt in, because we can't have the county quiet.
You mean to grab him? You mean to grab
If
Matt?
you don't mind. Thank you, Michelle.
Well, I just noticed Larry's not here today, is he?
It's quiet.
What'd you say?
Larry's not here today, I just noticed
Oh,
that.
he had a medical problem.
Oh.
He's really having some pain in his hip, and he's gonna go have an x-ray. There you are. You're being very flexible today, aren't you?
Yes,
Like, I
ma'am.
feel like a yo-yo. Thank you.
Yes, ma'am.
You wanna explain what we have here as far as who's signed up and this one?
Everyone that signed up, had previously been the leaseholder,
Right,
so I just need you guys to approve the leases.
so did everyone,
But we were missing one that I called you about.
okay, And it's not in here?
No, ma'am.
Okay. So, what you're saying is all of these have renewed
Yes, ma'am.
by the deadline in the very same names as previous?
Yes, ma'am.
Okay. Do you wanna go through those?
So with the one not turned in, I'll have to put that into the paper for this little bid process.
These are 3 years?
Yes, sir.
All down on Shoal Creek, isn't it?
Mhm.
Most of them are.
Yeah.
We got a few out near Stoughton, but none of these are out there.
I just don't know the name.
Probably gonna have to take those one at a time.
Are we?
We always have.
Okay. Let me do that. You got it.
They were in your head.
Now,
I would make a motion that we renew the 3-year lease, they are all 3-year, right?
Yes, ma'am.
With Toby Van Cleve.
Second.
I don't know, maybe we should have the address. It's 8314 Cherry Lane, Galena. We have a motion and a second. All those in favor?
Aye.
Motion carried. Michelle, I'm gonna go through these kind of fast and hand them to you.
That's perfect, okay.
I would make a motion that we renew the lease 3 years with Rick Womack for 7486 Southeast Pawpaw,
Second.
Galena, Kansas. Motion is second, all those in favor?
Aye.
Aye. Motion carried unanimously. I would make a motion that we renew the lease with Robert A. and/or Rosa M. Jones for 7963 Southeast Watermelon Lane, a 3-year lease.
Second.
Motion is second, all those in favor?
Aye.
Aye. Motion carried unanimously. I think I could have done that, but you're gonna have the right address.
Okay.
That was their home address. This is, the actual property is 7927.
Okay.
I would make a motion that we renew the 3-year lease for Gary and Ramona Eldridge for 7730 Southeast Watermelon.
Second.
Motion is second, all those in favor? Aye. Motion carried unanimously. I would make a motion that we renew the 3-year lease with Rhonda Walker for 00000 Southeast 78th Terrace, Galena.
Second.
Motion is second, all those in favor?
Aye.
Aye. Motion carried unanimously. Let's see, that one didn't have the pen on it.
I'm gonna need your signature on this, Myra, on the
You're
back.
gonna do what?
I need your signature.
Okay. Let's see, one of these didn't have a complete, the 78, that is Galena, right?
Yes, ma'am, I don't know why they went to that.
Okay.
Your friend didn't get,
And my
Too
house,
much.
I got 1.73 inches,
so
so.
you didn't get very much.
So,
2 inches.
and it's better than nothing, because we were starting to get into the severe drought, going from moderate to severe.
I thought it was just fine.
Oh, no, it needs to be, gotta have some kind of moisture.
You know, we was working, things going great. Stinking bubble.
Like I said, no.
Yeah.
Yeah. Big copies of it
Just sign on my desk.
in the clerk's office.
I have that back. I didn't put the title. This one's not signed.
I'll have to get with them and have them sign.
Pardon?
I'll have to get with them and have them sign the back of it.
Okay. I'm gonna wait.
Okay.
You do have the check?
Yes, ma'am.
You good with that, Ryan?
Yep.
You getting those to Michelle?
He's gonna make a copy and give it to me.
Thank you. Thank you so much, Matt.
Yes, ma'am.
Thanks, bud.
Yes, sir, ma'am. How are you?
Oh, anybody have anything for us right now? I would ask for a 10-minute executive session, non-elect employee, and to return at 10:03. Motion and second, all those in favor?